is Soumitra and you are watching my YouTube channel. So today I am going to discuss about the different positions, purposes and clinical uses of the positionings. Okay, so in clinical sectors or in our daily life also, positioning is very important, right? If you will not get proper positions, so you will be suffer with any kinds of infections also. So if in the clinical sectors or hospitals, okay, so if the patients will not get proper positions, so might be they will be so incooperated with the doctors or physiotherapists. So in that case we need to provide them a proper positions. So the proper positioning is very important. And also the proper positioning is helpful for the medical and surgical procedures or any kinds of investigations, okay, or any kinds of inspection, means the head inspections, neck inspections, cervical region, posterior, anterior thorax, abdominal inspections. So for all that cases also we need to the provide proper positioning to the patients. So and during the labor case also, okay, so that time also very important, proper positioning is very important. Okay, so today we'll see different positions. So different positions like supine positions or dorsal positions, okay, lateral positions. In that lateral positions also two types, like right lateral positions, left lateral positions, okay, sims positions and lithotomy positions, prone positions and knee chest positions, orthopedic positions, lithotomy positions, and so these are the positions. Okay, so first we will move on to the supine positions. What is the supine positions? What is the body postures of the supine positions? So in the case of the supine positions, the patients will be lying down on a flat surface. Okay, mean the head and the extremities will be lying down on a surface, on a plain flat surface. Okay, so mean at the degree of the 180 degree, at the degree of 180 degree, the patients will be lying down on a flat surface. So why should we provide the supine positions or dorsal positions to the patients? What is necessity? So if we provide the supine positions to the patients, it is very useful to the doctors. What is that usefulness? Like the doctor can easily assess the head, neck, means neck, face, okay, anterior thorax, abdomen, extremities. So they can easily assess and inspect the whole different body parts. Okay, so by providing them the supine positions. Okay, and that is the uses of the supine positions. And the next thing is the prone positions. It is opposed to the supine positions. Mean in case of the supine positions, so in case of the supine position we can see the face will be upward, right? Face, head, everything will be upward. But in the case of the prone positions, it is opposed to the supine positions. Mean the face will be downward, but whole body will be postured at 180 degree. Okay, but it will be opposed to the supine positions. Okay, it is opposed to the supine positions. Whole body will be lying down on a flat surface at the angle of the 180 degree, but the face will be downward and the posterior thorax will be upward, right? Understand? So look at the screen. So you can easily understand the position, so you'll get clarity. Okay, understand? And see what is the uses of the prone positions. Why should we can provide the prone positions to the patients? What is the usefulness? So the doctors, whenever they need to assess the posterior trunk, or they need to inspect the cervical region of the vertebral column, so what should they have to do? So they have to do, or they have to provide a positions which is favorable for their procedures or for their work. Means they wants to inspect the cervical region or the posterior trunk. Okay, so according to that they are providing the prone positions to the patient. And the next thing is the dorsal recumbent positions. So dorsal recumbent positions, what is this? So in that positions, so the doctors manages the patients will be lying down on a supine positions, but in the supine positions only, the two hands, two legs, okay, so two legs will be bended down, okay, two legs will be bended down. So the see the pictures, so you'll get clarity, okay. So means the whole body is lying down, but the legs are bended, and the foot of the legs is also touched to the bed, okay. So what is the necessity of this dorsal recumbent positions? Because the doctors or physiotherapists or nurses provided during doing any kinds of inspections like vaginal inspections or rectal inspections, okay, or in the sense of the enema doing procedures, okay. So that time also they can provide the dorsal recumbent positions, okay. So that is the purpose of the dorsal recumbent positions. And the next thing is the lateral positions. So I told you that lateral positions have two types, like right lateral positions and left lateral positions. So laterals means the side, understand? So the positions will be based on the means the slightly the patients will be lying down with the left side and right side. If the patient is lying down is a left sided, is it left sided, see the picture with clarity, like see in case of the left lateral positions, okay, left lateral position, so the patient is lying down is it with the playing or the applying the pressure or whole body is dependent on the left thigh and left abdomen and extremities, right? So that is the left lateral positions. And the in case of the right lateral positions, so whole body is dependent and lying down on the based on the right sided abdomen and right sided thigh and right sided extremities, okay. See the pictures, you will get clarity. So why should we provide the lateral positions to the patients? What is the necessity? So if we provide the lateral positions, if it is left lateral positions or right lateral positions, it doesn't matter, okay. So if we provide the lateral positions, we can start the procedure of the enema. So why the procedure of enema is necessary? Means though the enema is done whenever the patient is prolonged constipated, means he is not able to defecate properly at a proper time, proper day. So for those types of patients we need to do enema, right? And so for doing the enema we need to provide the positions of the lateral positions, okay. And for insertions of the suppositories to the rectal region, or from the rectal region we need to provide the lateral positions, okay. And also for the inspections of the and also vaginal inspections and rectal temperature, for measuring the rectal temperature of the patients we need to provide a lateral positions, okay. And next thing is the sims positions. So sims positions is almost same to the lateral positions, but there is little bit different. Mean in case of the lateral positions whole body is straight, but laterally whole body is straight. But in case of the sims positions we can see the right sided of the body and extremities will be straight, and the left sided left sided leg is rounded, means bended towards the abdomen, okay. See the picture, so you'll clearly understand the about the positions. See the picture, means the whole body is lying down and the right side of the leg is straight, right? And the left sided leg is little bit bended towards the abdomen. So why should we provide the sims positions? That is also the purpose of a like in case of the vaginal inspections or examinations or rectal examinations, we can provide the SIMS positions. Okay, and the next thing is that is the lithotomy positions. Why should we can provide the lithotomy positions? What is the positions? Lithotomy position. So the lithotomy positions, like in that positions the patients will be lying down on a supine position, but the leg will be elevated. The leg will be elevated. Okay, see the picture. So look at this picture. So the patient is lying down on a bed, but the leg is elevated and the whole rectal region is exposed to outside. Okay, so why it is exposed? So during the labor period or during the delivery, so we can provide this type of very preferable positions to the mother. Okay, so that is the best, very preferable position to the mother, lithotomy positions, because it is after giving this type of procedures we can see the directly or clear exposure to the rectal region. And also genitourinary procedures also, we can provide the positions of this, means the lithotomy positions. Okay, so that is about the lithotomy positions. And the next thing is the knee chest positions. Okay, so what is the knee chest positions? Knee chest positions, so look at this picture. So you can see the chest and the knee both are touched on the bed, and in that positions only the patient is placed or positioned. Okay, on a bed, means the chest and knee will be lying down on a bed, but whole body won't touch the bed. Okay, understand? See the picture, means like that positions. Okay, see the shape. So, so if that is the chest and that is the knee, so like that positions only the patient is lying down on the bed. Okay, so why it is necessary? For the doctors for providing this type of positions? Mean, if we provide this type of positions, we can easily inspect or examine the vaginal examinations. Means, in case of the vaginal examinations or rectal examinations, we can provide this type of positions to the patient. Okay, so that is the knee chest positions. And orthopedic positions I told you. So look at this picture, means the patient is lying down or seated on a Fowler's positions. So I'll tell what is the Fowler's position. So Fowler's positions. Okay, but at the level of the chest level we can see a placement of a table, and over the table we can see also one pillow is there, one pillow is placed. Okay, so orthopedic positions, it is usually uh, provided to those type of patients, having like breathing difficulties, dyspnea, okay, or chest drainage tubes procedures happens. So for those type of patients it's very preferable to this type of positions, to get this type of positions, orthopedic positions. Okay, and let's move on to the Fowler's positions. So in the Fowler's positions also, different Fowler's positions, like high Fowler's positions, semi-Fowler's positions, and poor Fowler's positions. So in case of the high Fowler's positions, we can see the whole patient is placed like a 90 degree. So the bed is 90 degree. Okay, so the patient is seated on a bed at the angle of the 90 degree. Okay, so what is the facilities of the Fowler's positions? So if you provide the Fowler's positions to the patients, we can see the patient will able to take breathe properly. Mean, those patients having the breathing difficulty, so if we'll provide the Fowler's positions, so they can breathe easily. Means, for breathing normally we can provide the Fowler's positions, and as I told you priorly, we are also providing the orthopedic positions. Okay, so facilitate normal breathing of the patients, we are providing the Fowler's positions. And also for facilitating eating or reading or watching the TV of the patients. For this type of activities also we are providing the Fowler's positions. But in the case of the SemiFollowers positions, so the angle of the bed will be 45 degree. Okay, what is that? 45 degree. So at this angle the bed is shifted, means the bed is ready and the patient is shifted at these positions. Okay, at the angle of the 45 degree the patient is lying down on the bed. So that is also having like same purposes of the like as like Fowler's positions. Okay, and so and the next one another thing, the next another positions is Trendelenburg positions. Okay, so Trendelenburg positions is like it is a positions. Why should you provide this type of positions to the patient? Mean when the patient, means when the doctor will provide this type of positions to the patients, what is the necessity? So suppose lateral, means the extremities perfusions occur to the patients, edematous conditions, or the venous circulation is not going on clearly,